Thanks very much, Melissa. It's great to be here. And I'm sorry that I didn't make it the last time I was scheduled to do this. It was, a tough decision where I had to just prioritise dealing with something in my own family. So, I sit in that space where I'm both, managing the system and occasionally having to navigate it as a consumer. So, thanks very much, Melissa, for that very kind introduction. And I guess the first thing to say is it feels a little overcooked to call this a presentation, because I took the conversation part pretty literally, and so I'm not going to be inflicting lots of PowerPoint slides on you. This is a little bit more conversational than that. And I hope over time that we'll have many conversations, but this is a good start and it's a good chance to get to know me and you. So as Mel mentioned, I worked for Queensland Health, but my story goes back a little bit further than that. In terms of the stuff that I think led me to here, one of the first things that I did that was a little out of the box in terms of a medical career was that back in the day when I was studying medicine, I got involved in student politics, and somehow I got elected to be president of the student union at the University of Queensland. And that involved taking a year off. And that's when I learned about systems and representation and advocacy and the importance of giving a voice to people who don't otherwise have a voice. And one of my jobs was to present the defence for students who were facing exclusion through the processes of the university. And that year just changed my perspective on how I might be able to contribute to the world. And I went through and graduated from medical school. But I wanted to get back into that sort of system space, and eventually I went down the pathway of becoming a GP and started to combine general practice and system work. And that started with the Medical Board of Queensland, where I worked for a few years, and then I shuffled over to Medicare, where I was looking at how we could use the funding levers to improve the quality of care that people had. And eventually I landed back in Queensland Health as the Director of Medical Services of a hospital, and then ended up in patient safety. So it was sort of a pretty zigzag pathway. And a lot of young doctors asked me, what should my 5-year plan be? And it's like, I just do stuff that feeds your passion, and the rest takes care of itself. So, I worked in patient safety with John Wakefield, who was the then executive director, and the areas that I had responsibility for were the open disclosure program, and I had the clinical safety part of, so I was dealing with a whole lot of stuff around preventing harm and also designing new systems. So many of you would be familiar with Ryan's Rule. That was one of my very first consumer engagements. That was something that I've noticed has really changed in the time that I've been away. So when we were doing the first consultation around Ryan's Rule, had this crazy idea to put consumers and clinicians in a room together to talk it through. And there was lots of anxiety in the system about this, and a perception that it would be a complete train wreck, and the whole thing was incredibly carefully managed. But we had the most fabulous conversations and discovered that the things that united us are far more than the things that divided us in terms of perspectives. And the success of that is evidenced by the fact that, Ryan's Rule is everywhere and was even being reported about in the press in New York when I was over there. So I left Queensland Health to go to the UN, where I was responsible for its healthcare system across the world, not the one that delivers directly to the beneficiary population, so not delivering healthcare services for refugees, but providing the health support for all the people that fan out across the world to do that work, including the peacekeeping soldiers, the aid workers, and the systems that keep them safe, secure, and able to focus on the needs of the people they serve. I came back to Queensland because my family remains here. I had done everything I dreamed I would do at the UN, and it was time to move on to a new challenge. And when this job opened up, it was like, wow, that's kind of a coincidence. And I've come back with a real desire to take some of that stuff that I learned in the UN and see what I can do to apply it here. And so what would those things be? Well, I think if I try to define the key things that changed me in terms of the UN, was a real appreciation, and I mean a real appreciation, in fact, a hunger for diversity. I've learned very much that you get better answers, even if the process is harder, you get better answers if you listen to people that you disagree with. And you need to really listen with an open heart and an open mind, because then you start to understand what's wrong with your own perspective, and you have to be willing to shift and move and adapt. And it's also about communicating effectively in the other way, so that people who might disagree with my perspective have a chance to understand that more fully, and bringing those diverse perspectives to the more fully. The metaphor I used to use with my team in New York was that if you look at a Rubik's Cube from one side, you will swear black and blue that that cube is either completely red or completely green or completely white, depending on which side you're looking at. And you will not understand why the person on the other side of the table is going, no, that cube is red. And you're going, you're an idiot, it is blue. And it's not until you actually get up and move around and sit on their side of the table that you can see that the cube is in fact the colour that they were saying. So I try and embody that in terms of how I listen and how we develop up processes and solutions. So that diversity of perspective and experience I see as an enormous value add. And then the other thing that I think I've, the skill set that I acquired is of brokerage. And what do I mean by that? It means being able to broker consensus, to bring diverse perspectives together into a solution that everybody can support. Maybe not everybody's 100% happy with, but that gives us the best of what is important to all of us. And I think that's something that's going to serve me well in my current role. So it's been an interesting year, as Mel mentioned. Mel, it's actually 4 months and 19 days. So I started working in Queensland Health on the 1st of June, and it certainly had its challenges, but those are also opportunities. You know, the basic internal governance of Queensland Health's just been thrown up in the air. A lot of the stuff that used to be the things that we would hang on to are not there anymore. A lot of the work of CEQ has been diverted into the COVID response, and I'll speak a little more about the work of CEQ in a moment. And so I find myself walking across a river on a set of floating stones that are constantly moving under my feet. Nothing is steady, nothing is stable, and it is constantly shifting. But I'm enjoying that because it means that I never know what the day is going to throw at me, and that's the kind of environment in which I flourish. So you will and you will have heard that one of the things that I have enjoyed, that I did previously and enjoyed, was those first baby steps of consumer engagement. And it's really very striking to me now how far we've come from those days when probably at least 70% of the people speaking to me said I was crazy to even try and have that conversation, to now we have consumers sitting on the tier 2 committees and many of the tier 3 committees, and very much a partnership and co-design approach, not always perfectly implemented. Okay, I am not here to say that we're perfect. I'm here to say that we know where we want to be and we have agreement about that, and we'll make mistakes along the way, but with good intent and goodwill, we will get there. And that's what I find really exciting, that the frameworks to implement that successfully are really strong. So for those of you who don't know CEQ, our role is basically as the system people for safety and quality. That's really the core function of clinical excellence. How do we make sure that the healthcare we deliver is safe, is effective, is equitable, is timely, is patient-centred? All of those very important aspects of quality have to be woven through the DNA of CEQ. And how do I see this, you know, what do I see as a potential opportunity for a strategic shift or the future vision? I think that historically, the focus in those quality domains has been, there's been a high focus on safety, which is very important because we can't have healthcare harming people, and that has to remain an imperative. But when you look at the other quality domains, many of them have been sacrificed in the pursuit of efficiency. And so that, and it's all been about efficiency and access. And for me, that leaves out what, and this is where my UN DNA comes out. I've come home and said, well, where's the equity agenda? Isn't equity a quality domain as well? And why is CEQ not talking about equity, and not just equity of access, but equity of outcomes, and making sure that the healthcare we provide delivers equitable outcomes to culturally and linguistically diverse communities, to our First Nations communities, to geographically disadvantaged communities? How do we bring that equity discussion in to be as important a part of the discussions about healthcare safety and quality as access and efficiency currently are? So that's going to be very much part of the future work of CEQ. But of course, we're also going to be one of the key divisions of the department involved in implementing the recommendations of the reform panel. I've lost count of how many of them have got CEQ's name written beside them. And we're going to need your partnership to do that well. As I've already said, you get the best answers when you get diversity of opinions. And to be working with consumers to really understand, what does safety feel like, look like, taste like, smell like to you? What is your experience? You know, my mum is in hospital at the moment, and I walked into the ward yesterday and discovered that her bed had been raised to an unsafe height for a frail elderly lady with a high risk of falls. And how does that happen? How does it happen that it takes a family member to spot that something unsafe is happening? And what can we do to partner better together to make sure that vulnerable patients, people who can't speak up, people who don't have a DDG as a daughter, are able to be heard and protected? These are really important conversations. So I'm really happy to be here this morning, really looking forward to future partnership with you, and I'm looking forward to the rest of this conversation.